Alright guys, now that you had a chance to take a break, we're going to pick up with carbon monoxide poisoning. Now carbon monoxide, this is caused when certain fuels are not able to combust properly. When carbon monoxide is inhaled, what happens is reducing the amount of oxygen within the bloodstream. By what it do, and what it's doing is it's inhibiting the body's ability to use it. So what happens is when the patient breathes in carbon monoxide actually has a greater affinity to bind to your hemoglobin than oxygen does. So person goes, breathes it in, it then circulates. Patient doesn't realize it until they start getting very weak and nauseated, and actually go unresponsive. These patients will have dyspnea. They'll have red, flushed skin. They need to be placed on high flow oxygen immediately, and eventually possibly have to get put in a barometric chamber. They will also have a very high pulse ox because your pulse ox, it doesn't actually monitor the amount of oxygen. Um, the reason being is all it's doing is it's measuring the amount of how saturated that hemoglobin is with some type of substance. So if carbon monoxide's on it, it might read it that it's 97% saturated, but it's not 97% saturated with oxygen. The initial symptoms of carbon monoxide poisoning are similar to those of the flu, but there's no accompanying fever, no body aches, or swollen and tender lymph nodes. You should also consider carbon monoxide poisoning whenever you do encounter unexplained flu symptoms, such as headache, nausea, vomiting, and confusion, especially if the symptoms are shared by people within the same environment. If you suspect that someone has been exposed to carbon monoxide, evacuate everyone within the enclosed space, even people who apparently have no symptoms. Ideally, patients should be moved at least 150 feet from the suspected source of the carbon monoxide into open air. All patients with suspected carbon monoxide poisoning must receive medical care. Many develop delayed neurological complications after initial recovery. Transport a carbon monoxide poison patient immediately, even if they appear to be recovering. Cyanide, this comes in many different forms. It can enter the body in a variety of ways. It's commonly found in certain types of poisons, fruit pits, as well as certain types of polish. If you burn plastics or silks, it can also be produced by it. And what it's doing is, instead of interfering with the use of oxygen at the hemoglobin, it's interfering with the use of oxygen all the way down at the cellular level. Cyanide poisoning in large doses can cause death within a few minutes. If you ever watched a old spy movie and you would see them pop a pill or eat a piece of candy or crack a tooth and then eventually suddenly die, it's from cyanide poisoning. They've poisoned themselves. The patient may progress quickly from early signs and symptoms to more severe effects. Um, the signs and symptoms of cyanide poisoning include, during the early stages, headache, confusion, agitation. You may have the smell of bitter almonds coming from their breath. During those later stages, or those seen in large dose cyanide poisoning, include seizures, pulmonary edema, cardiac arrest or dysrhythmias, and even acidosis. Care of these patients, number one, is your scene safety. If the scene is not safe for you to go in, do not go in. But if you are able to, try to remove the patient from the source or the source from the patient. Make sure that you are able to maintain a patent airway. If the patient is breathing adequately, apply high flow oxygen via a non-rebreather. If not breathing adequately, start them on positive pressure ventilation. and immediately transport and intercept with ALS. Acids and alkalis. Strong acids have an extremely low pH level. They're commonly found in liquid plumbing drain openers and other bathroom cleaners. Alkalis, on the other hand, have an extremely high pH level. they are they are in the form of either a liquid or a solid, and are also commonly found around the house in plumbing drain openers. Acids cause burns directly on contact, causing immediate and severe pain. Around the burn site, the tissue often dies immediately, producing a protective layer to lessen further burning. Alkalis also burn on contact, however, it takes longer to recognize the burning sensation. Alkalis tend to burn deeper by continuing to burn through tissue for longer contact times because the burn goes unrecognized for longer periods. Signs and symptoms, you want to make sure that you look very closely at the patient. Do they have any burns around the mouth or lips? Any signs of dysphagia, stridor, dyspnea, any abdominal pain or signs of shock? Care for them. Make sure that the scene is safe not only for you but others. If they have any contamination on their clothing, remove it and decontaminate the patient before loading them up in transport. Try to maintain a patent airway. If the patient is ventilating properly but not oxygenating, place them on non-rebreather. Or if they are oxygenating properly but not ventilating properly, place them on positive pressure ventilation. And then also consider calling for ALS and immediately transport the patient. Hydrocarbons, these are substances that you'll find in lighter fluid, cleaning agents, kerosene. This is a byproduct of some type of burning a byproduct of a substance that causes a combustible product. The toxicity of it varies, and poisoning can go through any of the various entryways such as ingestion, inhalation, or absorption. Patients who most commonly poison with hydrocarbons are those under the age of 5. The toxicity of the hydrocarbon varies widely and is somewhat dependent on the viscosity of the substance. The lower the viscosity, the greater the risk of aspiration, and the greater the potential side effects. Hydrocarbon poisoning can cause a variety of signs and symptoms, such as coughing, burns to the mouth, tachypnea and cyanosis, seizures, cardiac dysrhythmias, altered mental status, headache, and dizziness. Care of the patient is to try to remove them from the environment and decontaminate the patient. Try to maintain an open airway and maintain pulse ox at or greater than 94%, and then rapidly transport the patient for evaluation. Methanol or wood alcohol is a poisonous form of alcohol in a variety of common products such as gasoline, antifreeze, windshield washer fluid, paint removers, sterno, and other canned fuels. Methanol is a colorless liquid, and it's different from ethyl alcohol. Also, that ethyl alcohol is also called ethanol or drinking alcohol. However, methanol is the form of alcohol that is designed. Backtrack. Ethyl alcohol is the form of alcohol that is designed for consumption. Methanol is not. Methanol poisoning can occur from ingestion, inhalation, or absorption. Children may ingest substances containing methanol alcohol accidentally. When ingested, it causes the liver to produce massive amounts of acid within the body. Onset of signs and symptoms following ingestion usually occur within 40 minutes to 72 hours after ingestion. Signs and symptoms are typically related to the central nervous system, GI system and overwhelming acid within the body. Blindness can, blindness can occur from the ingestion of as little as 4 milliliters of methanol. Patients may present also with signs and symptoms such as seizures, nausea, vomiting, um, dyspnea, tachypnea. Care for methanol poisoning is primarily supportive. Administration of ethyl alcohol or drinking alcohol can prevent the methanol from being converted to an acid. An antidote called fomeprazole is now available and can be administered in the hospital. For us, it's just making sure that we are able to maintain a patent airway, give oxygen, and transport. Isopropanol or rubbing alcohol is the most common form of isopropyl alcohol. It's in many households. Isopropyl alcohol is also in many household products such as cosmetics, degreasers, disinfectants, and other cleaning agents. Poisoning most frequently occurs through ingestion, both accidental and intentional. Alcoholics might ingest isopropyl alcohol as a substance for ethyl alcohol. Isopropyl alcohol is more toxic than ethyl alcohol, but less toxic than methanol or wood alcohol. Following ingestion of isopropyl alcohol, the liver creates acetone. This has a major effect on the central nervous system, gastrointestinal system, as well as the kidneys. The signs and symptoms of isopropanol poisoning occur very rapidly, usually within the first 30 minutes following ingestion. Isopropanol acts as a central nervous system depressant, causing respiratory depression, can also cause altered mental status. The patient may also present with bloody vomit. Care of the patient is try to maintain a patent airway, maintain an O2 sat of at least 94%, and transport the patient to the hospital. Ethylene glycol, this is commonly found in detergents, radiator antifreeze, windshield deicers, and coolants. Children are commonly susceptible to accidental ingestion of ethylene glycol. The products usually are very colorful and have a sweet taste. Therefore, children ingest the substance containing ethylene glycol with no reason to believe that it is harmful. The signs and symptoms of ethylene glycol poisoning commonly occur within 3 stages. Stages are associated with the time from ingestion and affect various body systems. During the first stage is when you have your neurological symptoms such as uncoordinated movement, slurred speech, nausea, vomiting, hallucinations, and seizures. As we progress into the second stage, you'll start developing tachypnea, cyanosis, heart failure, and pulmonary edema. If we reach the third stage, now we've affected the renal system, so the patient will have little to no urine production, pain within the flanks, as well as bloody urine. The emergency medical care for ethylene glycol poisoning is primarily supportive. However, administration of ethyl or drinking alcohol should be considered. Be prepared to manage seizures as well as respiratory arrest. Poisonous plants, this includes poison ivy, poison sumac, as well as poison oak, that can cause dermatitis or skin conditions. Emergency treatment includes ensuring that the scene is safe for you to go in, taking PPE and decontamination if any plant substance is still on the body. You should first ensure that your ABCs are okay, and then routine treatment for this type of absorbed poisoning is mainly supportive until arrival at the hospital. You should keep the patient from scratching at the site, as this can cause a break within the skin, which can enable an infection to set in. Suicide bags, also known as exit bags, are a common form of euthanasia growing worldwide. EMS crews within the United States are encountering patients using the suicide bag as a less violent method to commit suicide. method is pretty simple, inexpensive, and made from materials and ingredients that are accessible to the general population. With these type of patients, they will usually use helium or nitrogen, um, and then place it into a bag and then put the bag over the head to basically let them go to sleep and to put them in a sense of euphoria, and then they suffocate. Scene safety is very critical because the helium and nitrogen can continue to fill up the room, thus causing a toxic environment for you. So if you suspect that, you want to contact the fire department, let them go in, clear the room, and bring the patient out. Poison control centers are a great resource that is available to us 24 hours a day, 7 days a week, 365 days a year. If we can tell the poison control center what exactly the patient has been exposed to, they can go ahead and start advising us on a treatment plan and then forward that information to the hospital. If we're able to, we want to verify the patient's age and weight, as well as condition and specifics post poisoning. And as always, if they suggest any kind of treatment, contact medical direction, verify that it is okay for you to do that treatment. I would also recommend if for you to have the number for poison control saved within your phones, and not necessarily just for if something happens um, to you or you need it while you're out in the field, but what if you need it for your children? Give me 1 second. I'm trying to find it on my phone so I can give it to y'all. All right, the number is 1-800-222 1-800 222 1 2 2 2. Easy number, right? During the next part of this lesson, we'll cover um, drug and alcohol emergencies and how to treat and care for these patients that have been exposed to these types of poisons. This drug and alcohol is considered a poison. It is doing harm to the body. This may cause issues such as altered mental status, respiratory depression, violence that is very unpredictable. Drug abuse is defined as the self-administration of drugs in a manner that is not in accord with approved medical or social patterns. A drug or alcohol overdose is an emergency that involves poisoning by drugs or alcohol. A patient's withdrawal from alcohol or drugs, or a period of abstinence from the drug or alcohol to which the body has become accustomed, can be as serious an emergency as an overdose. Several medical problems can result from any drug overdose or from sudden withdrawal from a drug. Among the most common findings are altered mental status, respiratory depression, damage to organs such as the kidneys or liver, seizures, cardiac arrest, and hyperthermia or hypothermia. The range of medical problems you can confront in a drug abuse patient is extremely wide and depends on the type of drug taken. For example, stimulants such as cocaine increases the patient's heart rate as well as their blood pressure, whereas depressants such as barbiturates or narcotics can lower their heart rate and blood pressure. Stimulants include amphetamines, cocaine, methamphetamine, nicotine. These cause an increase in a patient's alertness, may elevate their mood, cause insomnia, can also cause patients to become paranoid, agitated, and even violent. Cannabis includes marijuana, THC, What it does is it causes a sense of euphoria. The dry mouth, the patient starts drinking more, as well as decreases their inhibitions, so they may do things that they normally would not do. Narcotics and opiates includes codeine, morphine, hydrocodone, opium. What this does, it causes a depression of the central nervous system, thus causing respiratory depression, constricted pupils, nausea, and even constipation. Depressants, these would be your sedatives and tranquilizers such as alcohol, antihistamines, um, benzodiazepines such as anti-seizure medications. Um, what this does, it has effect on the central nervous system as well. Can cause the patient to become uncoordinated, cause them to have slurred speech, respiratory depression, and even respiratory and circulatory failure. Hallucinogens, these include LSD, PCP. Um, what this will do is cause the patients to become anxious and paranoid, may cause them to have flashbacks of something, may cause them to become have episodes of psychosis and hallucinations, and can make them become very violent. Inhalants, these are those that we were talking about earlier, such as those that have lighter fluids, paints, carrot gas, glues. It'll cause that excited, euphoric feeling, giddiness. May cause the patient to have hallucinations, erratic behavior. Now, habitual alcohol abusers or alcoholics, they are prone to a wide variety of illnesses, ranging from cirrhosis of the liver to all the way to peritonitis. In addition to causing medical problems, alcohol intoxication is a major cause of automobile crashes. Alcohol ingestion, even in smaller doses, is also a major factor within drug overdoses, homicides, burns, drownings, and general trauma. When assessing any kind of drug or alcohol emergency, you want to make sure that you do a proper scene size up. Scenes involving drugs or alcohol can involve violence as well as unpredictable behavior. Note anything that could be used as a weapon and consider calling for law enforcement. Look for any evidence of drug or alcohol abuse as well as other medical conditions. Start going through your primary assessment, building your general impression. Go through your ABCs, um, paying particular attention to the airway because it could cause the airway to become occluded because of the nausea and vomiting. Their breathing could be inadequate because if they've taken any kind of depressant. Look for any signs of trauma, as well as underlying medical conditions that could be exacerbated because of the drugs or alcohol. Go through your secondary assessment. If you have a patient with altered mental status, you want to do a rapid secondary. Go through your physical exam, try to get a history. Go through get your baseline vitals. Look at your signs and symptoms. Your high priority patients will be those that are unresponsive, vomiting with altered mental status, abnormal heart rate. Signs and symptoms can vary widely depending on the type of substance or drug that was abused. Often, the patient does tend to abuse more than one substance or drug. For example, a patient can take a CNS stimulant while drinking large amounts of alcohol and then take a CNS depressant. This would produce a wide variety of conflicting signs and symptoms that can make it more difficult for you to figure out what they took. With CNS stimulants, you might have dilated pupils, loss of appetite, um, tachycardia, excitability, agitation, and just general uncooperativeness from the patient. With depressants, they may feel drowsy and euphoric. They may have bradycardia, bradypnea, and even dilated pupils that are sluggish to respond to light. With narcotics, they'll also have that bradycardia and hypotension. They'll have constricted pinpoint pupils. They'll be nauseated and lethargic, as well as with cool, clammy skin, because of the vasodilation that the narcotics would cause. You want to look, see if you see signs of, let me get my pointer, track marks. This would be indicative of a patient that abuses IV injectable drugs. And now my PowerPoint's freezing. Oh well. With hallucinogens, these patients will be paranoid. You want to check their pupils because these will be dilated. Um, they may have a poor perception of time and distance. Maybe even be having visual or auditory hallucinations. You want to be careful with those that are having any kind of hallucination. Do not feed into the hallucination. Okay, don't if they say don't you see the green people, don't agree with them. Otherwise, it's just going to make things worse for you. If they've taken any kind of inhalant, you want to look see if they have any headaches, nausea, vomiting, um, drunkenness behavior, erratic pulse rate and blood pressure, as well as swollen membranes within the nose and mouth. With any kind of a drug or alcohol emergency, you want to make sure that the scene is safe for you to go in. Closely monitor your patient because they can go from steady, calm, to euphoric and very violent very quick. If they are getting a little agitated, try to calm the patient, protecting him and you from injuring each other, from injuring himself. Emergency care provided to the drug, substance, or alcohol abuse patient is mostly supportive. Scene safety is a priority at many of these scenes. Um, Make sure that you are able to maintain a patent airway and oxygenate your patient. Make sure you position them appropriately, and if needed, you may need to put restraints with medical directions orders. Try to maintain the body temperature because depending on the substance they took, it could cause them to become hyperthermic. Check their blood glucose levels, that way you can try to rule out any underlying medical conditions that could be causing their signs and symptoms. And reassess your patient frequently. Patients that have been involved with any kind of drug or alcohol, their behavior is going to be very unpredictable. So there are some considerations that you want to take when trying to deal with them to protect not only yourself, but the patient and any bystanders. One of these would be the talk down technique. This is a great technique to use to help decompress a potentially hostile situation. To do this, you want to try to make the patient feel welcome, like you are actually there to help themselves. So identify yourself to them. Let them know who you are. Don't invade the patient's personal space. So stay 5-6 feet away. Reassure that their condition is caused by a drug and is temporary. Help them verbalize what's happening to them. Explain what's going on. Explain to them what's going to happen. Reiterate any statements that you might, so that way the patient is able to understand. Also, let them know what will happen to them as the drug begins to wear off, and once they're calm, transport them to the hospital. Some considerations that we want to take with substance abuses is their tolerance and dependence. With tolerance, when they're taking a medication, they get to a point to where their body's used to it. Now it's not having the same therapeutic effect, so now the patient's having to take more of it to get that same feeling. Dependence is when the patient exhibits a strong need for use of the drug, such as smokers. When they get to the point that they're itching for a drag of a cigarette, they start getting a little jumpy, a little edgy, maybe start feeling a little anxious. You can also have what's called psychological dependence as well as physical dependence when a patient is going through withdrawal. Psychological is when the patient is focused on trying to get the drug. That's all they're able to focus on. They cannot focus on anything else. Whereas physical dependence is when the patient is going through the actual withdrawal effects. So they start getting sick and anxious and violent and some other signs and symptoms that we'll cover here shortly because they don't have that. They're unable to get their fix. Drugs that produce physical dependence include all of these. Those that we most commonly see in our area includes marijuana, narcotics, cocaine. Every now and then, it's not as bad as it used to be. Sedatives every now and then, and barbiturates. Now, it's important to recognize that drug withdrawal as a condition that can cause seizures or deterioration in the patient's mental status that can result in a blocked airway, inadequate breathing, or poor circulation. Some other things that we might see is anxiety, hallucinations, even tactile hallucinations. They might feel like something's crawling across their skin. They may suffer from seizures or tremors. Usually these symptoms start to occur and peak within 48 to, or excuse me, occurs when the next dose which should be taken, and usually peak within 48 to 72 hours. If they're able to make it through with the withdrawal symptoms, usually within 4 to 5 days, the signs and symptoms usually start to go away, and they tend to be okay. The alcoholic syndrome usually consists of problems drinking, in which alcohol is used frequently to relieve tensions or other emotional difficulties, and true addiction, in which abstinence of drinking actually causes physical withdrawal symptoms. Um, Alcoholics, they may try to hide their issues. They may start drinking early within the day and drink secretly, and even go on alcohol binges. They may also be dependent on other drugs while drinking the alcohol. Abstinence from alcohol is likely to produce withdrawal symptoms such as tremors, anxiety, seizures, or even delirium tremors. Um, Alcoholics can also periodically go on prolonged binges characterized by loss of memory or blackout periods. Alcoholics are prone to hypertension, altered mental status, cirrhosis of the liver, even liver failure. One of the most serious disorders associated with alcoholism is something called Wernicke-Korsakoff syndrome, which is a chronic brain syndrome resulting from the toxic effect of alcohol on the central nervous system, combined with malnutrition, which is something that is common among alcoholics because they'd rather drink alcohol than eat. Common signs and symptoms of this syndrome include paralysis of the eyes, dementia, hypothermia, and the inability to sort fiction from reality, and eventually coma if left untreated. Alcoholics are also prone to subdural hematomas because the actual alcohol actually causes the body not be able to coagulate as well as it used to. They're also prone to withdrawal symptom, which occurs after a period of abstinence from any drug or alcohol to which a person's body has become accustomed to. However, it does not require that the alcoholic or drug abuser stops drinking or taking the drug completely. This can also occur when an alcoholic's intake falls below the amount usually ingested. Alcohol withdrawal is dose dependent. The more the alcoholic was drinking, the more severe the syndrome will be. There are multiple stages of the withdrawal symptom. The first stage usually occurs within 8 hours after the last drink and includes nausea, insomnia, sweating, and tremors. Stage 2 includes stage 1 symptoms only worse, as well as hallucinations. These stage 2 usually occurs within 8 to 72 hours from the last drink. Stage 3, this occurs within 48 hours and may include seizures. Stage 4 can occur within 1 to 14 days and includes delirium tremens. The last stage of alcohol withdrawal, or delirium tremens, or DTs for short, is a severe life-threatening condition with a mortality rate of approximately 5 to 15%. DTs can occur between 1 to 2 weeks after the patient's 1 day to 14 days or 2 weeks after the patient's last drink, most commonly within 2 to 5 days. A single episode of DTs usually lasts between 1 to 3 days. Multiple episodes can last as long as a month. DTs should be suspected in any patient with delirium of unknown cause. Patients with that are going through DTs may present with tremors, dilated pupils, confusion, and even seizures. Seizures are a very common effect in alcohol withdrawal, but not in DTs. However, approximately a third of those who have seizures in early withdrawal do progress to DTs if left untreated or if treated inadequately. Treatment goals for a patient who experienced DTs include psychological as well as physical support, because this can be a very frightening experience for the patient. Opioids are any natural, synthetic, or semi-synthetic agent that mimics the effects of morphine. Opiate is a term specific to natural agents derived from opium. Narcotic is a much broader term that specifically refers to agents that induce sleep. Therefore, it does not truly describe an opioid. Although these terms are commonly used interchangeably, they do have different meanings. An opioid specifically refers to agents that act on opioid receptors within the body, such as heroin, which is a naturally occurring agent. There are the various types of opioids, such as morphine, fentanyl, and heroin, as well as carfentanil, which is used in veterinary medicine. The first three, morphine, heroin, and fentanyl, are three of the more common ones that we'll see in this area that tend to be abused. More common, these patients will be presenting with respiratory depression, hypotension, decreased respirations, hypothermia, because as the CNS depression continues to progress, they lose their ability to maintain their body temperature. Patients who abuse and overdose on opioid drugs and narcotics such as heroin have a depressed central nervous system. They often present with respiratory depression, hypotension, and bradycardia. Focus your care on reversing these effects, not to completely reverse the altered mental status. Many systems, definitely the ones all around here, allow EMTs to carry and administer naloxone to reverse these effects. To administer naloxone, you want to, as the basic, you want to administer 2 milligrams intranasally, or 1 milligram within each nostril. It's also a good idea to intercept with ALS, so that way if the patient continues to deteriorate, the ALS is there to help take care of the patient. Naloxone or Narcan, you want to draw it up. Most of the time, they may come pre-filled, where the syringe is already there, or filled with 2 milligrams of Narcan. You want to attach the mucosal atomizer device, and this will change it from a liquid into a mist. Oops. And then insert the MAD into the patient's nostril and administer 1 milligram of Narcan into each nostril. What naloxone is doing, it's binding to opioid receptors within the body and reverse all the receptor actions of the opioid by effectively blocking the ability of the drug to bind with the receptor sites. Patients may present with acute withdrawal-like symptoms, headache, musculoskeletal pain, edema, inflammation, and congestion as a side effect of naloxone. The emergency consequences of commonly abused drugs have unique effects. Others that are often abused include PCP, cocaine, amphetamines, and methamphetamines, and the drugs known as bath salts and ecstasy. Their use requires special consideration in the emergency care. One of the most dangerous hallucinogens is phencylamine, or PCP. Known by at least 46 names, it is also called angel dust, killer weed, peace pill, embalming fluid, elephant tranquilizer, horse tranquilizer, monkey dust, rocket fuel, goon, KW, or scuffle. It'll have very highly psychological effects, which can potentially last for years because it is actually absorbed within the body fat and released over time. Cocaine is inhaled through the nose or can be injected into the veins or injected into muscles. An almost pure form of cocaine, known as crack, is smoked. Another form of cocaine is heated and inhaled or freebased. And cocaine is a very highly addictive substance, and an overdose can be fatal because it can have very severe cardiovascular effects. Amphetamines and methamphetamines stimulate the central nervous system, thus causing and can also excite the cardiovascular system and can produce hallucinogens. Hyperthermia, muscle rigidity, or severe excitation can occur, thus leading to long periods of an awake and excited state. The resulting hypertension, hyperthermia, and increased muscle tone can be life-threatening. Methamphetamine use is associated with the sensation of ants or bugs crawling underneath the skin. The patient often picks at his skin or mutilates himself trying to get the ants or bugs out from underneath the skin. Panic attacks and visual and auditory hallucinations can also occur under the influence of amphetamines and methamphetamines. EMS is seeing an increase in the frequency or use of the illegal drug psychoactive bath salts, or PABS, or PABs. These bath salts have no ingredients related to hygiene. However, they are a synthetic designer drug with properties that inhibit the reuptake of norepinephrine and dopamine within the body. As a result, the drug acts as a central nervous system stimulant. The effect of the drug is similar to methamphetamine and cocaine and produces similar signs and symptoms. A long-term user can trigger up tolerance, and the sensation of use can trigger withdrawal and intense cravings. Patients who have taken bath salts can experience extreme sympathetic stimulation, such as tachycardia, hypertension, and seizures, as well as altered mental status such as panic attacks, hallucinations, paranoia, or agitation and violent behavior. Methylene dioxymethamphetamine, or MDMA for short, most commonly known as ecstasy, is a recreationally used psychoactive stimulant drug that produces a feeling of empathy, euphoria, and heightened sensations. That's why a lot of people that used to go to raves and would take them because of all of the lights and music and everything going on, that every sense would be heightened. It's also known as the street names of E, X, XTC, Smarties, Scooby Snacks, and Skittles. The drug has no medical purpose. MDMA is usually taken by mouth. However, it can also be snorted and smoked. When ingested, its actions begin after approximately 30 to 45 minutes and can last 3 to 6 hours. Overdose of MDMA can cause intracranial hemorrhage, severe hypertension or hypotension, seizures, hallucinations, acute respiratory distress syndrome, cerebral edema, and hyperprexia, which is a life-threatening elevation of the body core temperature. Physical signs and symptoms of PCP, cocaine, amphetamines, methamphetamines, or PABs are somewhat similar. However, you should remember that emergency management is supportive and not geared toward figuring out exactly what drug was used if the history is unclear. You want to treat any patient that's been exposed to any amphetamines, cocaine, PCP, MDMA overdose as you would any other drug emergency. Check quickly to determine whether there are any injuries that need immediate attention. If there are such injuries, administer emergency care as you would for any trauma patient, ensuring the airway, oxygen, and ventilation if required, and supporting the circulatory system before continuing with psychological care. Monitor your vital signs regularly and transport the patient as quickly as possible. Tetrahydrocannabinol, or THC in its natural form, is the principal psychoactive substance found in cannabis. Cannabis, also known as marijuana, is a plant that is used for its psychoactive properties as a recreational drug or medication. Common slang terms for marijuana are weed, bud, doobie, Mary Jane, pot, blunt, herb, hemp, and grass. Cannabis can be smoked or vaporized, eaten in a food, or used as an extract. It is used as a recreational drug for the mental and physical effects to get high or stoned. Does have some limited medical applications, such as those that have cancer. It's been known to help with those that are going through chemo. It is legal in 8 U.S. states. It is not currently legal in the state of Alabama. Users of THC tend to feel a general change in conscious perception. They start developing a euphoric feeling, increase in the awareness of sensation, and also the stereotypical symptom is a increase in appetite. Synthetic cannabinoids, often categorized as a new psychoactive substance or MTS, is a manufactured chemical that has similar effects as THC, which is found in cannabis. It is an unregulated substance that is sold as a mind-altering chemical. Common brand names are K2, Spice, Black, Mamba, Kush, Bombay, Blue, Genie, Zohai, and Chronic. Synthetic cannabinoids can affect the brain more powerfully than marijuana and can produce unpredictable and life-threatening effects. This occurs because synthetic cannabinoids bind more strongly to the cell receptors affected by THC. Cannabinoid hyperemesis syndrome is experienced by chronic cannabis users who report recurrent nausea, vomiting, and abdominal pain and cramping. A hot shower or bath can reduce the symptoms temporarily. Cessation of the use of cannabis will likely fully eliminate the symptoms. Acute episodes of the syndrome typically last for 24 to 48 hours. However, it can potentially take months to resolve completely after stopping cannabis use. Theories on the cause of cannabinoid hyperemesis syndrome include a dose-dependent buildup of cannabinoids and related toxicity, and the effect of the I'm getting tongue-tied today, and the effect of the cannabinoid on the receptors in the brain, primarily the hypothalamus, which regulates body core temperature and the digestive system. Emergency care for the patient focuses on ensuring an adequate airway, ventilation, oxygenation, and circulation. The patient can present with signs of dehydration due to vomiting and frequent hot baths and showers. If not treated, cannabinoid hyperemesis syndrome can lead to acute renal failure. Medication overdoses, this can be accidental or intentional, whether it be through prescription, over-the-counter medications. You can also have synergistic reactions that occur from the interaction of multiple medications. Accidental overdose typically occurs when the patient does not understand the prescription instructions and takes too much of the drug, or the patient is forgetful and mistakenly takes the drug more than often as needed. Patients who are on many different medications might have synergistic drug interactions when adding a new or over-the-counter medication. Medications commonly involved include cardiac drugs, psych medications, antihistamines, herbal remedies, and even dietary supplements. Many chemicals used for huffing accumulate in the regions of the brain responsible for feelings of pleasure and reward. After time, they migrate to other regions, where they can cause abnormal muscle coordination and alterations in mental status. Commonly used substances include paints, freon, and gas propellants. Keep in mind that inhaled poisons typically have a more immediate onset of effects than injected poisonings and can produce more systemic effects. Remember also that inhaled poisons can destroy lung tissue, thus leading to severe respiratory compromise and significant respiratory distress or failure. Treatment is geared toward removing the patient from the exposure, assessing and treating any loss of vital function caused by the drug, such as airway, breathing, oxygenation, or circulatory deficits, and providing rapid transport to the emergency department. Alright guys, that's it for this chapter. Make sure that you are doing your Brady Labs for this chapter. If y'all have any questions, just send it to me in Blackboard or in Brady Lab, and I'll get back to them as soon as possible, or just write them down and ask me the next time we are in class. Otherwise, y'all have a good rest of your day, and I will see y'all next time.